Hello everyone, my name is Vanessa and today I'll be discussing one of the most persistent barriers in modern healthcare, the prior authorization process, otherwise known as PA. Originally, prior authorization was designed as a cost control tool to ensure medical necessity before services were provided. However, over time, this process has evolved into one of the most significant sources of frustration for both patients and providers. My presentation today will give you a concise overview of the issue, the most relevant findings from recent research, and a proposed solution that emphasizes technology, transparency, and patient-centered reform. By the end, I hope you'll have a clear understanding of how reforming PA can restore efficiency, trust, and access to timely care. I hope you enjoy this presentation. Now let's talk about the problem with prior authorization, administrative burden, and delayed care. Did you know that 94% of physicians report care delays due to prior authorization? 1 in 3 report prior authorization contributes to adverse events, increased provider burnout and patient frustration, and prior authorization equaled less time for direct patient care and continuity. The data behind this problem are staggering. According to the American Medical Association, 94% of physicians say prior authorization has caused delays in care for their patients, and roughly 1 in 3 report that these delays have led to adverse clinical outcomes. For providers, prior authorization consumes valuable time that could be spent on patient care, time that should be spent on patient care. Many describe spending hours weekly completing redundant paperwork or navigating inconsistent approval systems between payers. This administrative overload contributes significantly to burnout, diminished job satisfaction, and a growing exodus from direct patient care roles. For patients, the impact is just as serious. Treatment interruptions, medication non-adherence, and unnecessary emergency visits. What started as a cost control strategy has now become a cost driver, both financially and emotionally. Now, let's discuss some research findings. Evidence for reform. Research from multiple studies have confirmed what many clinicians experience daily: that prior authorization delays not only disrupt care, but also reduce long-term adherence to treatment. Even patients with chronic stable conditions often face repeated authorizations for the same medication or services, creating unnecessary administrative loops. Emerging data shows promise, though. Health systems have started implementing electronic prior authorizations, otherwise known as EPA, and they've reported up to a 60% reduction in approval times and improved transparency for providers. The consistency of these findings across clinical and policy research highlights a growing consensus. PA reform is not optional. It's essential to protect care, quality, and sustainability. We're getting really close to the end. Let's talk about proposed solutions now. My proposed reform model emphasizes efficiency and patient safety through 4 main strategies. Now let's talk about those. First, streamline and automate the process through electronic prior authorization systems. Automation can reduce human error, accelerate approvals, and free up clinician time. Second, remove redundant authorizations for patients who have already demonstrated treatment stability. This alone would prevent thousands of unnecessary delays each year. Third, enforce transparency and accountability from payers, meaning standardize turnaround times and public reporting of approval and denial rates. Finally, push for federal standardization of prior authorization criteria to reduce inconsistencies between insurers and states. Together, these reforms would transform prior authorization from an obstacle into a system of collaboration and trust. Congrats, you made it to the last part of this presentation. So in closing, transforming the prior authorization process is not merely an administrative fix. It's an ethical and structural imperative. Every unnecessary delay represents a patient waiting for care, a provider losing valuable time, and a system that's drifting from its purpose. By integrating automation, consistency, and transparency, healthcare organizations can restore balance between cost oversight and compassionate care. Remember, the ultimate goal isn't to eliminate oversight, but to make it work for patient care, not against it. Thank you for listening. I hope you enjoyed this presentation. Any questions or discussions are welcome.